how to treat fatigue. This combination of behavioral, nootropics, and vitamins and drugs, which I'm about to talk about, is for people with psychiatric problems, people in drug withdrawal from opiates, benzodiazepines, or alcohol, people who are stressed. This does not work as well for people with major medical problems like heart, lung, liver disease, endocrine problems like thyroid disease. You have to treat the major medical illness first. But with that said, what is my stack to treat fatigue? First, I have to pre-treat someone so they will accept the nootropics, the drugs. And so what we would do, first of all, what not to do. You can't sit around in your room all day and scroll on social media. One, you have to exercise, you have to move around, you have to be in the sun, you have to eat healthy, nutritiously, no fast food, no crap, no sugar, no complex carbs, healthy fats, healthy proteins, virtually no sugar or carbohydrates. It just doesn't work. You have to hydrate with electrolytes. So that would be the stage you'd have to do. I mean, at least give yourself a fighting chance. Dramatically would improve the medications, the nootropics working. Then, the vitamins I use, I put everyone on, are complex B vitamins, just the mixture of all the B vitamins. You can buy them on Amazon, just B vitamin complex. Vitamin D3 with K1 and K2 at about 10,000 international units. I do 50 milligrams of zinc. I give everyone CoQ10 at about 50 milligrams. That's the stage I set to energize the cells, energize the mitochondria, increase endurance, increase focusing. Now, what drugs do I use? The number one on this list would be Provigil or nuvigil. Modafinil, armodafanil. You use nuvigil about 250 milligrams, Provigil, modafinil about 200 to 400 milligrams. That combination alone, behavioral modification on top of Provigil, is about 50% of people, maybe 60. That's a lot. Now, how do I up that? Well, the next thing I add are caffeine pills. 200 milligrams at 8, or when you wake up, 200 milligrams 4 hours later. Hopefully that won't cause anxiety. If it does, you have to back off. In a lot of people, it's tolerated very well. You can't give it too late in the day. You need about 8 hours after your last dose so you sleep. So now we have the Provigil and armodafanil, which is nuvigil. They increase histamine. I add the caffeine, which is adenylate cyclase activation. That works. What do I do next? A lot of people, what I've wound up adding was oxypiracetam at about 500 to 2,000 milligrams a day. People say, oh, I've heard of piracetam or phenylpiracetam, but it bothers your stomach. Oxypiracetam seems to work well. Another thing I've used is acetyl L-carnitine, 3 to 1,500 milligrams a day. That works great in your stack. So the Provigil type drugs, caffeine, the acetyl L-carnitine, caffeine, that's a great stack. Beyond that, for men, you can add testosterone, 50 to 100 milligrams a week. Women, not so much, but that gives a huge boost. That's about a 90% hit with that stack right there. That's huge. Now, what are the ones you can't do? So you behaviorally modify your behavior. You add this stack. That's what's good. Now, the level of sophistication out there, because people can go on AI, scan the internet. These are the things that people can get that I recommend you absolutely not do. Steroids. Yeah, steroids will energize you, but they're devastating to your heart, to your kidneys, to your lungs, to your blood, to your face, to your personality. They're horrible. They're devastating. Do not use steroids. Do not use STARMs, selective androgen receptor modulators, peptides. Keep away from it. They're different names for the same thing, if you ask me, and I'm not a fan. I'm absolutely not a fan. And don't comment saying, well, you put the idea in people's head. I put the idea in your head not to use it, is what I'm saying. I'm 100% against it. And nicotine is another one. Yes, nicotine is activating and it will give you energy. I'm totally against it. It teaches someone to develop an addiction cycle which transposes to other drugs. It's a nightmare. Cocaine's a disaster. Ecstasy is a disaster. And methyl diaspartate. There are other drugs. Huperezine. It's on the web. It's just another stimulant out there. It's a drug. I do not recommend it. It increases norepinephrine, dopamine. It basically predisposes you to addiction because it's basically like a stimulant, like methylphenidate. Do not use these. They work short term for energy, but it develops a whole addiction cycle and turns into a nightmare. There are other amphetamines, methamphetamine, dextroamphetamine, and all the molecular deviations of methylphenidate and dextroamphetamine are a nightmare. Yeah, they increase dopamine, norepinephrine. They will wake you up and treat fatigue temporarily, but lead to an addiction and a high and a crash, and they're horrible. There are other ones out there. Huperezine is another one you can buy online, which is basically stimulant-like. Fencamfamine, another amphetamine-like drug. Do not use that. There are some older drugs which are amphetamine or stimulant-like. Fenfluramine, phenteramine. Remember those were fen. They're used for weight loss. A lot of stimulants, a lot of amphetamines. Curb your appetite. They were disaster. That fenfluramine, phenteramine have affect the heart, affect heart valves. They were used for people who had obesity and to help them lose weight. And they were a disaster. I think phenteramine was pulled from the market, but you can get them online. Do not get them. All these stimulant-like, amphetamine-like, addicting-type drugs, steroids, do not use. I'm serious about this. I'm adamantly opposed to them. Under no circumstances use them. It won't work. I've used them for 40 years for attention deficit disorder, and they have their own set of problems. Although they help with attention deficit disorder, they have their whole new set of problems when used for fatigue. Because in terms of fatigue, you need more and more of the drug. You develop tolerance to the fatigue side effect or effect, and you need more and more, and eventually it doesn't work. And just to get out of bed, you need them. It's a horrible cycle. Thank you.